John Fleming is the assistant to the president for planning and implementation. He also serves as a deputy chief of staff to President Trump, and he joins us this morning to talk about COVID and where we are. Good morning, Dr. Fleming.
Good morning, Linda. Great to be with you.
Nice to have you with us this morning. How are you surviving COVID yourself? Everyone in your family healthy and doing well?
Well, I'm very blessed. My wife, 4 adult children and 3 grandchildren have all been COVID-free. But we've been using common sense, not going crazy, but wearing masks, washing our hands, and distancing appropriately when we're among other people.
So many Americans are skeptical about what we see about COVID, what we read about COVID, what we hear about COVID. We know that it's a reality, Dr. Fleming, but the numbers can be so misleading because depending on who you hear them from or where you read them, they can be so skewed in one direction or another. Do we have a handle on COVID in the United States?
We do, Linda. Absolutely, we do. I mean, look where we started from. We had an invasive virus that's highly contagious, somewhat deadly, that came from China. President Trump very brilliantly shut down travel very early under a lot of criticism. Once it got a foothold in our country, the administration went to work alongside Congress to be sure that Americans would have plenty of personal protective equipment, especially for our healthcare workers. Put the Defense Production Act in place so that we would produce enough ventilators. Not a single American went without a ventilator or an ICU bed if they needed it, but also to get a head start on therapeutics and vaccinations. We're going to be developing vaccines that could be deliverable as early as October in record time, something that's never been done, not even close. So this has been an all-of-government effort led by President Trump, and what we're seeing is that the number of cases in Mississippi and around the country are flattening out and declining, and also the fatality rates have gone down dramatically as well by at least 2/3 among all age groups. So we're getting better and better at this. We've learned to live with this disease, but it's been a lot of hard work. We've lost a lot of good Americans. That's unfortunate. But we really look to a very bright horizon at this point.
According to a report that came out, the head of Harvard's Global Health Institute has said that even if we don't have increasing cases, if we're keeping things flat, as you're saying, in many states, that it's reasonable to expect that we're still going to hit a $200,000 mark when it comes to deaths in our country. And that could reach that number sometime in September, just through September. Is that a reality?
Well, we're already at 172,000 deaths, but remember, nearly half of those are in nursing homes, and we're asking the states, the governors, the state health departments to redouble their efforts because, nursing homes are actually regulated by the states, and to take every action possible to protect Americans. But look at it this way, Linda. Think of the millions of Americans that could have died from this disease had we not taken all of the appropriate actions, spent a lot of money to make sure businesses would survive and provide goods and services to Americans. And we need to get our kids back in school. Look, we're seeing more and more complaints about kids becoming somewhat neurotic and even suicidal ideations and so forth. We've got to get them back in school, but in a safe manner where we socially distance, wash hands, and wear masks when appropriate.
The president has walked a very fine line between those issues you just referred to, our economy, our mental state as Americans, and then also keeping the country safe. And it is a difficult line to walk because we don't want our economy to die out. We don't want to face higher suicide numbers, and we're already seeing some of that. Divorce rates are reportedly increasing, people being stuck with each other a lot more than they had planned. But I think more so the stress of all of us, it does wear on us. How difficult is it for you? And we know how the president feels about it. He's very vocal about it. But other leaders in positions like yourself, to walk that line and to hear the complaints, even from Trump supporters who are worried about sending their kids back to school, who are afraid that we're not doing enough, who aren't trusting their state government, their own governor, to do what's right. Because, let's face it, President Trump has thrown it back to states and said, you need to be responsible for your own state and decide what's best for you.
Linda, absolutely. I mean, the federal government can provide guidelines, and we do through the CDC. But what South Dakota does versus Mississippi versus California, it really differs upon how the state is structured, what the economy is like, what the school system is like. So really many of these decisions have to be done by the governor and even mayors across the country. But they're doing a great job. They're working along, despite the fact that you hear Democrat governors criticizing the president. When you get on a phone call with them, they're so thankful to the president and the vice president for all they've done. I'm part of the task force, the coronavirus task force, and we meet very frequently, Dr. Birx and Dr. Fauci and others. And we have been working alongside all of our partners, both government and non-government, and also state governments, on all of these issues. Again, ventilators, PPE, vaccines, therapeutics, and doctors have determined a much better approach to seriously ill people with this. They have much better tools in their toolboxes, like antiviral remdesivir, dexamethasone. We're going to have an exciting announcement pretty soon on convalescent plasma, which is infusing antibodies from people who've had the disease into those who are currently ill with it, and other exciting treatments. So, look, your listeners out there should be very optimistic for the future. Just be careful. And what we're also seeing is, remember that the deaths are occurring among vulnerable parts of the population, people over 65, people with comorbid conditions like diabetes, hypertension, cancer. So protect your loved ones, protect your neighbors, protect your grandparents, people who are vulnerable. Identify them and do everything you can to protect them. But those of us who are younger and part of the younger part of the population can go about their business. Just use common sense, protect yourself, but most of all, protect the vulnerable.
Dr. Fleming, I know that you do not want to get into politics, and we won't spend a lot of time on that because that would be a whole nother show. And let's face it, in America, everything becomes political. But now with the Democratic National Convention on, and it's nothing but a Trump bash, how do you keep all that rhetoric that's going out from confusing Americans about what is truth and what is it that all these wonderful things you're talking about, how do you keep that from getting clouded by the negative that we hear so that that positive does surface to the top?
Well, Linda, you may know that I served 8 years in Congress representing Louisiana, Northwest Louisiana. So I've been involved in politics for many years. And, the one thing I have to say is you have to give Americans credit. They can really tell BS from everything else. And, this so-called convention from the Democrat Party was just absurd. They were reporting the viewer rates, and they were really very low. It was more like an infomercial, which turned people off. Mm-hmm. And look, you can't win an election if your only theme is the other guy is bad. They have nothing to deliver. Of course, they brought us Obamacare, which has been a disaster. It's caused rates of health care costs to go up stratospherically. They want to bring socialism to this country. They want to be led by people like AOC. So, look, the American people are smart, and as they focus after Labor Day on who's really led this country and the economy, cut taxes and regulations, brought our stock market and businesses and jobs to record levels, especially for the middle class and especially for the working class, and also minorities. African Americans have done better during the Trump 4 years than they've ever have in history. So the American people get this, and especially the people of Mississippi. I'm originally from Mississippi.
Let me let you go just for a second as we go to break, Dr. Fleming, and we'll come back to you to talk a little bit more. We want to finish up talking about Mississippi and how we're standing. We're talking to Dr. John Fleming. We're talking about COVID this morning with Dr. John Fleming. He was a lawmaker in Louisiana for 8 years, I guess he told us, and assistant to the president for planning and implementation. He also serves as a deputy chief of staff to President Trump. So he is in the trenches there. He sees what's going on. Dr. Fleming, we know you you've got a busy schedule, but I do want to ask you about Mississippi before you go, because we've heard so many things, and in just looking this morning, it doesn't appear on the latest map that I've seen of the United States that we are a hot spot again. It looks like that's dissipated a bit. It's back down into Louisiana and the New Orleans area. From what you're seeing, where is Mississippi right now in its standing with COVID?
Mississippi is really in sync with the rest of the South as the shutdown was sort of relaxed and businesses opened back up and people began to get back to work and active. We saw an expected rise in cases, a lagging curve of deaths, unfortunately. But that has now dropped and flattened out. So it's actually looking quite good. And if Mississippians will just use good common sense, wear a mask when appropriate, socially distance, and wash hands, just be very careful, protect the vulnerable. Look, we're going to come out of this thing very soon, and as I say, certainly by the end of the year, we're expecting to have a very effective and safe vaccine that'll put an end to it all. So it's looking good in Mississippi, but it can flare up again. We can have local outbreaks. Just be very careful.
How concerned is the president that although the percentages are small, we are seeing changes in who is dying from this? Just last week, we heard that a teenager without any pre-existing conditions in Mississippi died from COVID. We had a pregnant woman in her early 20s. We have seen some cases across the country of children under 40 is now the hot age. We're seeing that more and more young people are getting it. They are surviving it, but they're getting it. Is the president concerned about these new numbers and changes that we're seeing in the statistics?
Yes, he is, Linda, but once again, it's only because there's been a shift from elderly people getting this to more younger people, more adults and so forth as I say, go back to work, they socialize. So with a shift towards younger people getting this, you're going to see, although rare, you're going to see deaths. And so nobody is 100% protected from death in this, and that's why everybody should be careful. But again, that doesn't mean we have to completely shut our world down, because there's risks on the other side, as I mentioned earlier, suicides and overdoses and all the other things that can happen as a result of just shutting yourself off from society for months. So we have to be balanced in our approach.
Dr. Fleming, Russia, China, the U.S. now all say that they're working on a vaccine. You've mentioned the vaccine several times. Would you be one of the first in line to get that vaccine when it becomes available?
I would, Linda, and the reason is that we're not skipping any step. I'm in day-to-day conversations with Dr. Hahn, who is a commissioner of FDA, and we're doing everything we would do with any other vaccine. The reason why we're able to deliver it so rapidly is because the U.S. government under President Trump has put out billions and billions and billions of dollars to not only push candidates for the vaccine, but to put them into production just in case one or two come in early. So we're not doing this in a serial fashion where we wait till we get a good proven vaccine. We're actually producing vaccines whether they're proven or not, but we will not deliver them to the American people until they're proven safe among 30,000 volunteers.
Well, Dr. Fleming, when that vaccine becomes available and you're getting ready to get it, I want you to contact us and let us know, because we're going to follow you through this.
You bet. I'll be. You can be number 2 in line behind me.
I'm going to see how it does with you, Dr. John Fleming, the Deputy Chief of Staff to President Trump. Thank you for joining us this morning and sharing your insight to COVID. Appreciate that. Thank you, sir. Have a good day.
Bye-bye.